Shawn McAnalley here with Dr. Bill McAnalley, the expert in apoptosis. Guys, we're going to talk some more today about adaptogens. We're going to talk about one adaptogen specifically, and that is American White Ginseng, and how it can really help the body to repair. Dr. Bill?
Thank you, Shawn. Yeah, I think it's fascinating that whenever we start to learn the pathways that it works on, then we can predict, what it will do.
Mm-hmm.
And one of the things all the adaptogens do is they work on that same pathway that activates 500 genes to repair all parts of the cell.
Mm-hmm.
One of the things they do, they activate autophagy to clean up the cell.
Mm-hmm.
Then they remove the cell parts that have been damaged too much to be repaired, and then it gives you new ones.
Mm-hmm.
And of course, that takes several weeks to months, to accomplish all of this. But once you get the genes activated, they start working on it.
Mm-hmm.
And so I was looking at some of our adaptogens,
Mm-hmm.
and this knowledge really started when the Russians started using Siberian ginseng
Okay.
to get their athletes to perform better, and they did.
Mm-hmm.
And they didn't know how it worked. They couldn't find a drug in there. They couldn't figure out how it works. Well, now we know that adaptogens activate those genes it's kind of like starting, when you're a baby, all those genes can work for
Mm-hmm.
you. And then as you get older, when you finish developing the heart, you turn off all the genes that have done their job.
Right.
And in this case, you reactivate genes that control inflammation and damage and cleaning up your cells. And of course, whenever you've had chemo
Mm-hmm.
or radiation,
Mm-hmm.
you damage a lot of the healthy cells.
Mm-hmm.
And people just don't have energy. They don't feel like they used to feel.
Mm-hmm.
And so what I like is Mayo Clinic.
Mm-hmm.
When the top hospitals thought, well, let's try American Ginseng.
Mm-hmm.
They took 340 patients in a double-blind placebo-controlled study.
Mm-hmm.
And
that's different than the Russian ginseng we talked about. It's red
it's
ginseng.
American.
Yep,
It's
different.
white ginseng, but
Yep.
it's still in that family of ginsengs.
Mm-hmm.
And it's been shown to activate the same pathways that the other ginseng did.
Mm-hmm.
And so what they showed
Mm-hmm.
is that in 4 weeks, it looked like one group was getting a little better.
Mm-hmm.
In 8 weeks, one group was 20% better.
Wow.
That was huge. So
Yeah.
the way nearly all double-blind placebo-controlled studies work, if you volunteer to take a chance of getting the placebo,
Mm-hmm.
if they show that the drug works, when they show it works,
Mm-hmm.
they'll give it to you.
Mm-hmm.
And so they stopped the study
Mm-hmm.
and gave it to the other half that hadn't been receiving the benefits of it.
Mm-hmm.
But that way they proved beyond a shadow of a doubt
Mm-hmm.
that ginseng, that American ginseng,
Mm-hmm.
helped cancer patients get better by fixing their cells that have been damaged by the chemo and radiation. So I think that's wonderful
Mm-hmm.
that happened.
And I guess theoretically, if it's going to fix some damage by chemo, it'd fix cells damaged by something else too.
That's right.
That's right. Good deal. All right, well, Dr. Bill, thank you so much, guys. That's more on adaptogens. We'll be back with you with some different adaptogens and how they help the body. We'll see you next time. This is For the Health of It.